You're muted, Charlene.
You're
Yeah,
live, Mark.
I was just waiting for it to go live. So you guys are all set now.
Thank you. So this is calling the LCAR to order on April 1st, 8 o'clock. First item on the agenda will be to approve the minutes of our last meeting. And before we do that, even though our names are all here, introduce yourselves, please, starting with Senator McDonald, Chair of the LCAR Committee, and let's go down the list as it is on our letterhead. So,
Which
Well,
list?
that makes me second, actually, according to my letterhead. I'm Joe Benning from Caledonia County. I represent the Caledonia District, which is all of Caledonia County and the 6 northeasternmost towns in Orange County.
You're muted, Senator.
I'm Senator Chris Bray. I live in Bristol. I represent Addison County and Huntington and Buell Score. Thank you.
Good morning, Ginny Lyons, Senator representing Chittenden County.
Good morning, Trevor Squirrel, representing Underhill and Jericho.
Good morning, Seth Baumgartz, representing Bennington 4, Manchester, Arlington, Sandgate, and most of Sunderland.
Yes, good morning, Representative Mark Higley from Lowell. So I represent Lowell, Jay, Westfield, Troy, and Eden.
Good morning, Carol Odie. I represent the far new north end of Burlington.
oh, that's who we are. Next time we're going to do this, we're going to tell the committee we're on, because we cover a variety of committees and we've been selected to be a cross section of the legislature. First item on the agenda to approve the minutes of the most recent meeting. Do we have a motion?
Moved, so moved.
Okay, the motion has been made to approve the minutes of our most recent meeting. Is there any discussion? If not, all in favor say aye.
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 All opposed say nay. And the minutes have been approved. First item on the agenda is the emergency rule 21E02, emergency rule. And the witnesses, Charlene, are?
Witness is Lauren Lehman.
Laura Lehman, would you, the floor is yours to speak to the emergency rule.
Thank you. My name is Lauren Lehman. I'm a staff attorney with the Office of Professional Regulation. We regulate notaries public and offer commissions for them. In the beginning of the COVID-19 pandemic, we passed or offered, and the LCAR approved a emergency rule for remote notarization, which requires still a wet signature on a paper document, but it is done through a remote appearance between the signer of the document and the notary. The rules last 180 days as emergency rules. They were renewed again in September because of ongoing concerns about notaries being in the same room with the signers of the documents. And we are asking again for another 180 days as we don't quite feel that it is yet safe for folks to meet. We don't feel this is a permanent solution, and we're working on more permanent long-term solutions, but for the time being, we do think it is necessary to keep these in place for an additional 180 days.
Any questions for the witness?
I take it it's worked well in the meantime as we've gone along?
It has. The initial rules were developed in collaboration with a large number of stakeholders, including real estate bars, probate courts, and so far people have been using them well. You know, there's been some pushback on some elements, but folks have been able to adapt.
Any other questions for the witness? So we have a a rule that's been in place for some time, and because the COVID emergency is extended, this is being extended, and there are no changes to the in the process of extending. Thank you. Someone had Senator Bray.
Thank you, Mr. Chair. I move approval of Rule 21E02.
Motion has been made to approve the rule. Is there any further discussion? If not, all those in favor say aye.
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 All those opposed say nay. The ayes appear to have it. They do have it. The rule has been approved. Senator Lyons.
Just clarification, Mr. Chair, when we vote, are we also required to put our hands up so that we can get a vote count?
Yes.
Thank you, Senator Lyons. I got the last one from hearing no nays and seeing no nay hands. It was unanimous. Thank you. I will try to see that happens more clearly for the next one, which would be
Thank you all.
21E03. And once again, the witness is Lehman, correct?
Yes, the witness is Brandon Atwood.
This would be Brendan Atwood's. Thank you, though. I'm all set. Thank you all.
Okay.
Momentary.
So, the floor is yours.
Thank you.
Brendan Atwood, my apologies.
No worries. Thank you, Mr. Chair and committee members. Good morning. Thank you for inviting me to join you today. My name is Brendan Atwood. I'm a policy advisor with the Health Department. And with this filing, the department is proposing to amend the hospital licensing rule. The hospital licensing rule establishes the standards for licensing of hospitals in Vermont. And there are two changes being proposed through this emergency rulemaking. First, this rule would allow hospitals that have been granted waivers by the Centers for Medicare and Medicaid Services during an emergency to be automatically granted waivers for their Vermont licenses as well. And additionally, two requirements for psychiatric hospitals have been added at the request of DVA to ensure compliance with the waiver agreement that Vermont has made with CMS. In drafting this rule, the department worked with the Vermont Association of Hospitals and Health Systems, the UVM Medical Center, and DVA, who have reviewed and support these proposed changes. So with that, I'll be happy to answer any questions that you may have.
You've stated that this is similar to the last rule in that it continues many provisions already in emergency rule, and that you have added two additional provisions. Perhaps you could give the committee a bit of detail on those two additional provisions.
Yeah, that's correct, Mr. Chair. So these two additional provisions, again, were requested by DVA and are required to go in effect this year in order to ensure compliance with the waiver agreement that Vermont has made with CMS. And what they do essentially is require that these psychiatric hospitals follow up with patients within 72 hours of discharge. And they also require that these psychiatric hospitals utilize a nationally recognized patient assessment tool to determine the appropriate level of patient care. And they already do that. So in that sense, this is just a bit of a formality.
Are there any questions for the witness? Representative Squirrel.
Yeah, I guess I have a couple questions about this. When did the department learn that this needed to be included in the rule? And I guess, when do you need to be in compliance? And if you're out of compliance, then what's the penalty?
Yeah, thank you for those questions, Representative. I believe we learned about this right around the new year. And I think that this has to be in place by the end of this calendar year. I really can't speak to what the penalties or repercussions are associated with a failure to adopt this compliance. I think DVA might be able to inform that better, but I would be happy to look into that and follow up with you if that would be helpful.
Continue, Representative Squirrel.
Yeah, just a follow up to that. And I guess I'm wondering what the relationship is to COVID-19, since that's the purpose of the emergency rule.
Yeah, thank you for that question. This was not, these psychiatric hospital requirements were not the impetus of this rulemaking, but given that we are going to continue with the emergency rulemaking for the other provisions, we thought it made sense to include this in here, seeing that we would have to do it at some point anyways. We will be going through regular rulemaking shortly, and anticipate finishing that before the end of this calendar year.
Senator Lyons.
So the emergency rules are consistent with legislation that we passed last year, and then more recently with S 117, and was signed into law by the governor before March 31st. So the emergency rules are allowed to continue until March of next year, March 2022. The new provisions on psychiatric hospitals and psychiatric care are what I would consider to be belts and suspenders during the emergency period, but I think also very critically important, so that these folks don't get left by the way.
Are there any further questions? Senator Benning.
Hearing no questions, I'll move approval of Rule 21-E03.
Senator Benning, the motion has been made that 21-E03 has been the rules be accepted and approved. Is there any discussion? If not, we'll do both a show of hands and a verbal thing. All those in favor say aye.
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 All those opposed say nay. Was that a nay?
No, I thought I was supposed to put up my yellow hand and for the A, and then
Oh.
I didn't take that back.
Thank you. And the rule has been approved, which brings us to the big one. 20P015. The first, I think the first order of business is to have a motion to accept the request from the Department of Health to extend the date of adoption of this rule. Senator Lyons.
I yield to Senator Benning.
Senator Benning.
Appreciate that. I'm just going to move that we approve the request for an extension of 20-P15.
Motion's been made to accept the extension of 20P015. Is there any further discussion? If not, please raise your hand and say aye.
Aye.
Those in favor say aye.
No, Senator,
Aye.
Mr. Chair, I think that Representative Squirrel's hand was up when you asked for discussion.
Thank you.
It's really just a
Representative
quick
Squirrel.
Yeah, just a quick question. To what date are we extending this to?
I believe that the request was for a 30-day extension, although, we anticipate, obviously, we're going to provide testimony on this rule now, and we should be able to have
All
this
right, so
done shortly.
yeah, so 30 days. Okay, great.
Yeah.
Thanks.
Thank you.
Thank you, Chair.
If there's no further discussion, Senator Benning.
Actually, Mr. Chair, I thank Representative Squirrel for bringing that up. My understanding is the 45-day review end date is April 29th. I'm not sure if that factors into that question.
I believe you're correct. The extension was for the purpose of being able to meet the be finished by that date, and it's a 30-day extension from March 28th, and we would have an opportunity at our next meeting before the deadline to approve the rule if we were not to do so today. So we have a motion before us to accept the request for an extension. All those in favor, please raise your hand and say aye.
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 Opposed? Nay? Appears again to be unanimous. And we have a witness that is prepared to speak to us today on 20P015. And is that Ms. McCarthy?
Mr. Chair, that would be me again, although I would
Oh,
like to introduce Meg McCarthy, who is joining me for this today. She is the Compliance and Enforcement Advisor for the Environmental Health Division at the department, and should be able to speak to any technical questions, perhaps a little better than I will be able to.
So you are both welcome to speak in the order in which you have scheduled yourself. So the
Thank
floor
you.
is yours.
So with this filing, the department is proposing to amend the regulations for lead control. The purpose of this rule is to protect the public health by reducing the exposure, lead exposure for the public, with specific precautions for children who are more vulnerable to lead hazards. So this rule provides the requirements for work practices, licensing and training for lead-based paint activities and renovation, repair, painting, and maintenance, or RRPM activities, in order to prevent the creation of lead hazards that cause lead poisoning. This rule applies to 3 categories of the public: those who perform or train individuals who perform RRPM or lead-based paint activities, property owners of pre-1978 target housing or child-occupied facilities, and homeowners when conducting RRPM or lead-based paint activities in their own private target housing residences. And the major change made through this rulemaking is that all individuals who are licensed to work on pre-1978 buildings where lead paint will be disturbed will now be licensed and regulated by the Department of Health rather than by the EPA. And so while this marks a fairly significant change for the department, for the regulated community, these rules are essentially the same as what currently exists. By bringing these rules under the purview of the department, we do anticipate the better protection of public health facilitated by greater outreach and education, as well as a more efficient and streamlined licensing process. During the drafting of this rule, the department worked with many stakeholders, including the EPA, the Associated General Contractors of Vermont, the Vermont Housing Conservation Board, the Vermont Home Builders and Remodelers Association, lead paint abatement workers and trainers, lead paint inspectors, and licensed lead-based paint contractors. And so we have worked to take their input under advisement and address the concerns and comments that they raised with the department through this rulemaking. So that's a very brief overview of this rule and the rulemaking. And again, with that, I'd be happy to answer any questions that you may have.
Representative Higley.
Thank you, Brendan. So with the Department of Health taking this over from the EPA, I know there's a fee for these contractors to go through this course. Changes in that fee on.
I'm sorry, Representative, I had a little bit of interference there hearing you, but I believe you asked if there was any changes in the fees. So the fees are prescribed in statute, and so this rule does not specifically impact or address the fees.
Okay, thank you.
Thank you.
Are there any questions for the witness? What were the substantial objections to this rule, if you might share with us?
Yeah, thank you, Mr. Chair. There were no objections in terms of the department taking over this rule. There was kind of consensus and support for that. In the public comment period, we did have some objections raised in particular to a requirement that a third party conducted what's called a dust clearance for certain RRPM activities. And the commenters noted that this was different from what the EPA required. In review, we determined that we would no longer require that third party clearance and that an RRPM supervisor who would remain on site would be able to conduct that inspection, which is consistent with EPA's current regulations and still ensures protection of public health.
Thank you. Senator Lyons, did you have a question? You're muted.
Just a quick question. And what do you expect, if anything, to change between now and when you bring this rule back to us?
Thank you, Senator. My hope was that we don't have to bring the rule back and that it will be able to be approved today. We're prepared to move forward with this rulemaking. with this implementation rather. So hopefully we won't need to come back. But if we do, I don't anticipate any changes unless they were requested by the committee.
I guess my question relates to the extension request that you've made. Was that simply to get to this date?
That's correct, Senator. Yeah,
Okay, that was unclear. So I will say that in review of the rule, as chair of the committee of jurisdiction, I did find that the rule is in compliance with statute. So just to give that information to LCAR.
Thank you, Senator.
Yeah.
Senator Benning,
So, Mr. Chair, now I'm confused. We've granted an extension, but I'm hearing now that the request is actually for passage of the rule. Am I hearing correctly?
Senator Benning, there's an extension, and were we to continue, move to postpone our decisions, we have time to do so. We've actually approved the extension retroactively today because we did not have any intervening meetings before this came up. And it is our prerogative to approve the rule today or to extend and ask for additional testimony should we seek additional testimony. I perhaps should have deferred to Anthea, but to Ms. Dexter Cooper, but she'll interrupt me if I have been in error. So
You're good.
Representative Squirrel.
Yeah, I guess my question would be that we received notification that there was going to be a request for extension. I guess I would ask the committee members whether they've taken the time to do their work to read through the rule, or maybe put it off until the extended time. And I want to make sure that we've all had that opportunity to work through the rule before we approve it.
Representative Higley.
Yeah, I would have to agree with Representative Squirrel on that one. Now that we have granted the extension, I may want to reach out to some contractors and maybe look closer at exactly what they are taking over from the EPA.
That would certainly be an option. It would require a motion and further discussion would be in order at that point. Or further discussion can continue now.
In that case, Mr. Chair, I make a motion that we postpone action on 20 PO 15 until such time as it comes back. I guess it would be prior to the extension date. Is that correct?
We will defer right now for that question to our counsel, Ms. Dexter Cooper, and perhaps Charlene will also help by saying when our next scheduled meeting would be, were we to make such an extension, or what our choices are.
So for the record, Anthea Dexter Cooper from the Office of Legislative Counsel. My understanding is that you do have a meeting scheduled next week and there are no rules scheduled to be heard at that meeting. You certainly could postpone 1 week until next Thursday, the 8th. You also would have the 15th available to you before the 30 days from March 28th extension is up. And if my math is correct, there would be 1 more week in there as well.
Okay.
So several options within the 30 days.
Before we went online, Ms. Dindo was suggesting that we would meet 2 weeks from today, unless there were any new rules filed. Is that correct?
That's correct.
So there we have 3 options: a week from now, 2 weeks from now, when we have a rule. We would be meeting 2 weeks from now. Is that correct, Charlene?
I mean, you can meet, I would suggest that you meet next Thursday, April 8th. because the adoption deadline is only for 30 days, so that you need to give them time to do the adoption.
This is why we call Charlene Dindo the boss. Thank you. That's the recommendation.
So in that case,
Representative Higley
Mr.
was
Chair,
gonna,
yes, in that case, Mr. Chair, I would recommend that we move the final decision to our next meeting, which is the 8th of April.
Senator Benning.
So just as a logistics discussion, do we have any other rules right now pending for the 8th? Because if not, I would be urging we move it to the 15th.
I don't think you do.
I would hate to come back just to approve one rule if we can avoid that extra meeting.
There are no pending rules. And the deadlines for the April 8th meeting has already gone by. So you could do the April 15th.
Representative Higley.
I changed my motion again to the 15th. Again, it would also help me in my efforts to get some information. As you can imagine, in my committee right now with pensions and other things, we are completely swamped.
Hearing no objection, we will accept that the original motion has been withdrawn and has been replaced. Thank you, Representative Higley. The question is, shall we postpone action for 2 weeks? Senator Bray.
Before we lose the witness, I just wanted to ask a quick question. So, and that is a clarification. Do these rules apply to landlords in the same way that they apply to professionals who would come in to do a painting job?
Thank you for that question, Senator. There are requirements on both of those groups, but they are distinct requirements.
Okay, thank you very much.
Representative Higley.
Yeah, if I could just ask one question of Mr. Atwood, could you either send us in our emails or whatever your best contact information?
Yes, absolutely. Charlene, how would you prefer that? Should I send that over to you and you can distribute that, or what would be the preference there?
Yes, you can send it to me and I can distribute it.
Great, thank you.
I do want to ask, what is,
Ms. Dindo.
I want to make sure, what is the date that you guys approved for the extension?
15th.
No, the adoption deadline extension, you approved that.
March.
30 days as of today would be April 30th.
I have it as 30 days of March 28th.
You have it as 30 days of March 28th. Okay.
Yep.
If I may, I think what you might be getting at, Charlene, is that I think if this is heard again on the 15th and approved, we might need to request an additional extension. I don't know if it's appropriate to modify our extension request to 45 days. But given that time frame, I believe there's a 15-day requirement from the date of adoption until or approval until it can be formally adopted. And so I think that if we came back on the 15th and this was approved, we would be in a situation where we might be out of compliance with that.
So thank you, Mr. Atwood. Can we count on the department giving us an additional extension where there's a motion to pass?
Yes, we will submit an additional extension request. Thank you.
Thank you very much. The question is, shall we postpone action until the 15th of next month? If there is no further discussion, please raise your hand and say aye. If you're in favor.
Aye.
Aye.
Opposed? And the motion has passed.
Thank you.
With that, do we have any new business? Any scheduling, Charlene, that we need to know about other than what we have already covered? If not, a motion.
Not that I know of.
A motion to adjourn would be in order. Senator Benning.
I would move to adjourn, Mr. Chair. Mr. Chair, once YouTube goes off, I would ask that the senators remain on the line for just a moment. It has nothing to do with LCAR. It's a logistical